What's up, YouTube? It's Kevin here, the Migraine Guy, bringing you one thing that you should do if you have to go to the ER because of your migraines. So it's very common that when a migraine intensity hits a certain point, that the kind of over-the-counter medications that might typically help, or even the prescription medications that you get prescribed by your doctor, or maybe even some other methods, just cease to stop helping. They don't take down the pain and intensity to a level where you can actually function. I've had this experience before. I've done a video about what to expect when you go to the ER. I can put a link to that guy there. But as far as this video goes, it's about the one thing you should do if you do go to the ER because of your migraine pain. And that simple thing to do is to not let them do anything until you see the doctor. So if your emergency room or hospital is something like mine, you check in, and then you go into a room, and one or two nurses or maybe a phlebotomist or someone comes in, and they want to get your blood pressure, they want to take your temperature, they want to find out why you're in there, they want to start a regular saline IV drip. And the one reason that I'm saying to not let them do anything before you see the doctor is that all of those small things that they're doing add up quickly into hundreds of dollars. When I went to the ER, I did not let them do anything before I saw the doctor. And the doctor came in, told me what the options were: CT scan and some pain meds and an IV. I said, well, if that's it, then I'm just not going to do it. I can go home and have some whiskey for $15. Versus however much they were going to charge me. And they still sent me a bill for almost $650. Now, I didn't end up paying that bill because they did not perform any treatment on me. I had to fight them a little bit. But the main idea is, if you're going to go to the ER because of migraine pain, then you really should be talking to the doctor before any sort of procedures are begun, because you might not want the particular medication that they're going to start giving you. Maybe there's no reason for your blood pressure or temperature or even a basic IV drip to get started. If you're there for one thing, you don't have to let them do a number of other things. And that's the real reason I want this video to get out there, is that when you go to the doctor, they provide a service, whether it's the ER or anybody else. And so as a service provider, you can tell them specifically what service you want provided. And if they say, well, in order to get X, we have to do Y and Z, that's different than just go in, let them do a bunch of stuff, and then get the pain meds that you're there for. So this might be a little difficult if you are going through a really, really bad migraine. And so if you have someone there that can be an advocate for you, telling nurses, doctors, or medical professionals, no, we do not need those things. What we want is this. Then that can hopefully save you a couple $100, right? I mean, those ER visits can add up quickly, and so saving yourself a couple $100 if you have to go semi-frequently could pay off in the long run. So that's the video, just a simple thing you can do when you go to the ER. Take it easy.